Today we are going to discuss the topic of eyelid. So eyelid are actually the lids of our eyeball. Indirectly we can say that eyelids are a movable fold of skin, muscle and connective tissue collectively that protects the entire surface of the eyeball. So before diving deep into the anatomy of eyelid, first we will discuss some of the important terms related to the eyelid. So this is our upper eyelid and this is lower eyelid. Upper eyelid is up to the level of eyebrow and lower eyelid is up to the level of lower orbital margin, or the place from the cheeks start. There are some other structure like uh, the lid crease or upper lid crease that can be seen, like this is the upper lid crease and this is the lower lid crease. We will discuss about these crease in the later topic. The other thing is medial canthus and lateral canthus. Normally these the upper and lower eyelid, and they combine on the medial at the nasal side. They this structure is called as medial canthus, and on the lateral side this is called as lateral canthus. This is medial canthus and this one is the lateral canthus. Normally the medial canthus is about 2 millimeter above as compared to the medial canthus. Then the other thing is palpebral fissure. So the space between the two lids, is known as palpebral fissure. So we can divide the space like, if we can say this is vertical space and this can be the horizontal space. So if we discuss about the horizontal space, this is about 28 to 30 mm. So this is the horizontal space. This is about 28 to 30 millimeter, and in case of the vertical length it is about 10 to 18. So this is vertical palpebral fissure and this is about 8 to 10. So in this picture, this is the upper lid crease, this is the lower lid crease, this is the lateral canthus and this is the medial canthus. The upper eyelid covers round about 2 millimeter or 1/6 of the cornea, and lower eyelid is just touches the limbus. This is very important because upper eyelid, if it covers more than 2 millimeter, then we call this condition as ptosis. Now we will discuss about the anatomy of the eyelid. So anatomy of the eyelid, so we basically divide the eyelid into anterior lamella and posterior lamella. So we divide it on the basis of the gray line. If you can see, this red one is like the gray line that divides whole of the eyelid into two parts, anterior lamella and posterior lamella. If first we will talk about the anterior lamella and then we will talk about the posterior lamella. So anterior lamella, first of all, it consists of the skin. If you can see, this is the skin. The main thing about the skin is that it is very thin skin, and as age goes, like when someone get old, this skin may bulge out, and this can be considered as a condition which can block the normal visual normal visual field. So the other thing is the thin sheet of areolar tissue. So this is the thin sheet of areolar tissue. So the most important thing about this is that it lack fat. Because it lack fat, it does not show any kind of resistance if there is accumulation of blood or fluid. So this can be seen if there is any injury of the eyelid. We can see that there is accumulation of the fluid or blood occur mostly in this layer, the areolar tissue, because it lacks fat. The other is orbicularis oculi muscle, which can be seen like this brown one. We will discuss it in the later part. The other thing is subcutaneous connective tissue. The main thing about this connective tissue is that it contains vessels and nerves. So during any kind of surgery, it is important to give anesthesia in this layer because it contains the nerves. Now we will discuss about the posterior lamella. So first of all, it is consist of fibrous layer. So fibrous layer, first of all, fibrous layer consists of two things. First one is dorsal plate. As you can see in this picture, this one is the dorsal plate. The other thing is palpebral fascia. In some books, instead of writing palpebral fascia, they write it like preorbital fascia or orbital septum. like orbital septum mainly. Orbital septum like this one. So orbital septum, this is our orbit. Periosteum of the orbit form the orbital septum, and later on this will continue and connect with the dorsal plate. So one of the important function of this orbital septum is that it separates the orbit from the eyelid. So if any type of infection that affect the eyelid, it mainly could not be able to enter into the orbit because of this orbital septum. The other parts of the posterior lamella are levator muscle, aponeurosis, molar muscle. We will discuss all the muscles in later part, and the other is conjunctiva. You can see the conjunctiva covering the eyeball, covering the side of eyeball. The other are muscles. So first of all is orbicularis oculi muscle. So it consists of mainly two parts, palpebral part and orbital part. The orbital part is present inside the orbit and the palpebral part is present in the eyelid. So it is supplied by the seventh nerve. Palpebral part is in the eyelid and it is mainly protector of the eye. So it closes the eye. The other is levator palpebrae superioris. You can see this muscle. This is the levator palpebrae superioris muscle. So after its origination in the end, it formed the aponeurosis like this one. It is the main elevator of the eye. It is supplied by the third nerve and it also forms the upper lid crease, as we have discussed earlier about the upper and lower lid crease. So the upper lid crease is mainly formed by the levator muscle. You can see in this picture the whole of this red muscle is actually orbicularis oris, but you can see these silver kind of patches are the aponeurosis of the levator muscle that coming out of the orbicularis oris. The other is molar muscle. The main thing about this muscle is that it is a smooth muscle. The other two muscles we have discussed earlier are actually skeletal muscle, but this is a smooth muscle, molar muscle, and it is innervated mainly by the sympathetic nervous system. So you can see about this molar muscle. So this is levator muscle. It is forming its aponeurosis, this green one, and this aponeurosis is passing through the orbicularis oris muscle. This is orbicularis oris muscle, and beneath the aponeurosis there is another muscle. This is known as molar muscles, and in the upper eyelid it is connected with the dorsal plate. As you can see, this is the dorsal plate and it is connected with the dorsal plate. In case of the lower eyelid, the things are little bit different. In the lower eyelid, as you can see, this is this red one. This is inferior rectus muscle and it is forming a ligament known as fascia, known as capsulopalpebral fascia, this green one, and the molar muscle is originating from here. As you can see, this red one is the molar muscle. So then we will talk about the glands. First one is the meibomian glands. So these are present inside the tarsal plate. So these are also known as tarsal glands. They are actually modified sebaceous glands that are embedded in the tarsal plate. So they are directed vertically. So this line is important surgically when we will discuss about different diseases. So this is very important because they are directed vertically. And the other gland are Zien's gland. These are modified sebaceous glands. So this one is Zeiss gland, and the last one is Moll's gland of Moll. Like these are the modified sweat gland, and they open into the hair follicle directly into the lid margin.